children and teenagers must cope with the dangers of peanut allergies. But now researchers are hoping a new kind of oral immunotherapy could be a game changer for some of these kids. We've got Dr. Reena Mehta with Uptown Allergy and Asthma with us with the results of a new clinical trial. Dr. Mehta, first of all, good morning to you.
Good morning. Thank you for having me.
And second of all, tell us how this new therapy could be a game changer and how it works.
Okay, so this was a landmark article, I will say. This is really exciting information. It was published in Lancet very recently. And what they did was they basically had the concept that if we can identify those toddlers ages 1 to 3 years old with peanut allergy and then theoretically desensitize them through oral immunotherapy, could we actually cure them of their peanut allergy? So I should take a step back and explain what oral immunotherapy is. That's basically where you're giving gradually increasing amounts of peanut protein, so that may be through peanut flour or through peanut butter, to basically shift the immune response from thinking it's allergic to building a tolerance over time.
But this is a therapy that would be done in office with your allergist, correct?
Oh, 100%. The rate of having allergic reactions is high because you're obviously giving these babies foods that they're allergic to, so you have to do it with a board-certified allergist. But the thought is that with time, if you can actually gradually desensitize them, you can not only cure them of their peanut allergy, but they could be done with the allergy completely.
So where is this trial, or what stage are we at in this trial right now?
So that's a great question. So I do want to take a minute to explain what the trial was. So they took 150 children ages 1 to 3 years of age with known peanut allergy. And what they did is over a span of 30 weeks, they basically split the group into two. Half of them received increasing doses of peanut flour and half of them received placebo. And they would mix it in something that kids would like applesauce or pudding. And basically, after the 30-week period, theoretically, the hope was that most of these patients would be desensitized where they could eat up to equivalent of 8 peanuts. So then once they reached that level, those patients went home and continued eating that for 2 years. They continued a daily dose of this 8 peanuts. And they found that after the 2.5 years, 71% were desensitized. So then after that, what they did was they said, okay, stop eating peanut. So they took it out of their diet for 6 months because they wanted to see, okay, then when you reintroduce it, even though they haven't kept it in their diet, are they still not allergic? And so what they found was after the 6-month period of not eating peanut, 21% actually were cured in remission of their peanut allergy.
This is major. Again, I know the study was just done, but I know for parents at home or caregivers at home who know a child or have a child with a peanut allergy, what does this mean for them? How soon can this be something that they could be offered at their allergist's office?
So I think what was most remarkable about this study was they found that the children who were younger, those who were 1 year of age, actually did the best. And
Gotcha.
So what the thought is that when you're young, your immune system is maturing and it's still trying to figure out what it wants to do in life. And so if you can theoretically shift the immune response within that first year or 2 years of life, you can actually cure them of a peanut allergy. So they found that 70% of those 1-year-olds actually were cured of their peanut allergy, as opposed to 20% of the 3-year-olds. So the thought is the earlier the better. The lower levels of peanut IgE or peanut allergy antibodies, the lower they are, the better it is. So really this provides a window of opportunity where if your child is allergic to peanut as an infant, we can jump on this now, hopefully, so that we can actually cure them of their peanut allergy so they don't have this lifelong allergy.
We're out of time, but really quickly I have to ask you that this therapy is not yet available for families.
Not yet
It's something
available.
that's still being
Hopeful.
looked into.
Exactly. More clinical trials need to be done, but I mean, this is hopeful. I think it will be in the next few years something that we can easily provide for our patients.
Well, Dr. Mehta, that's amazing, and I'm sure parents out there and caregivers out there would have to agree. We appreciate your time. We want to talk about this again as we get further into this this study and these trials, so hopefully we can do that as we get more information. But we appreciate your time this morning.
Thank you so much for having me.